In this video, we're going to show a series of photographs kindly volunteered by my patient Marianne to give you some insight into the changes associated with facelift surgery over the first 2 months of recovery. Marianne was a 52-year-old lady with all the classic signs of facial aging, as you can see here. Significantly sun-damaged skin, which is common in this generation, nasolabial lines, marionette lines, a stringy neck and fallen cheeks. She also has heavy upper eyelids with a relatively flat brow. This is a combination we often see in this particular age group and is a great indication for the surgery she chose. Here she is on the morning of surgery with slightly different lighting, but again you can see how all the signs of facial aging are still present in this photo. The next picture we jump onto is her about 4 hours after her operation. Here she has all the classic signs of swelling and bruising that we would normally expect from a facelift. Here she is 24 hours later with actually some of those signs improving noticeably. We see this quite commonly, and I often tell patients that the worst swelling or bruising can be at day 4 or day 5. Here on day 3 she actually looks pretty good with her eyelid dressings in place. Day 4 you can see how she's starting to swell a little bit. The eyes are a little bit more closed, which again is pretty normal. The face and cheeks are also quite tight. Day 5, a little bit of that swelling is starting to leave her. Her bruises are turning from dark to yellow, which is a positive sign, and she looks slightly more normal. Day 6, again, small steps, but definitely progression. The bruising is coming out even further, and you can see the steri-strips on the eyes starting to separate. On day 7, this is typically the day we've taken the stitches out, which is why she has no steri-strips. You can see quite a lot of swelling around the eyes and upper eyelids and cheek. And again, this is only slightly improved on day 8. Day 9, she's starting to look a little bit more normal, in my opinion. Her eye bruising is now mostly yellow. Her jawline looks better defined and her eyes are less swollen. Although, as you can see, there's good days and bad days, because on this day 10 photo, I think her eyelids look a little bit more swollen. Day 11, again, a relatively good day. You certainly wouldn't necessarily think she'd be comfortable going out to the shops or with friends looking like this. Although day 12, a slightly better day. As I mentioned, we see good days and bad days, and it can be quite unpredictable. Day 12, a relatively good day. The best thing you can do during this recovery period is using cold packs for swelling, and if there's any stiffness, which usually develops around 3 weeks, then some heat can be applied. In this photo, everything looks pretty good. The jawline looks well defined, but the eyelids look a little pulled laterally. Day 13, broadly the same, and again, this is a noticeable day for upper eyelid swelling, in my opinion. You can see how there's only small steps being made. Typically this is normal from day 7 to day 14. There's relatively subtle changes. I think here in day 14 you can see some genuinely positive changes. She looks more natural. With some cover-up makeup, she could almost consider going out and about. Of note, you can't really cover up dark coloured bruises, only when they're yellow or pale. You can see she's tried to do that a little in this photo. Here on this day 15 photo, she actually looks pretty good straight ahead. You can still see how everything's a little bit tight and a little bit shiny, but the jawline again is well defined. Her scars around the ears are settling reasonably well. If you look carefully, you can just about see the scar in the sideburns of the hairline, but these are starting to soften. All the stitches are removed, other than the ones that dissolve. Here on day 16, again, the bruising has settled a little bit more, but still not completely even after 2 weeks. I think the face looks a little less puffy and a little bit more natural. The upper eyelids are still a little swollen, and there's still a gentle pull around the lateral corners of the eyes. Here's a side-on view where we can see the incisions healing around the right ear. I think day 17 again, she looks relatively natural. The eyes look good today with quite a lot of lid show. And again, the left side, you could argue that this is healing slightly better. We often see this, how one side behaves slightly different from the other. Day 17, I think, again, this is a good day. She looks relatively natural in this oblique photo. Other than the bruise under the left, she could probably go out looking like this today. Here on day 18, from the lateral view, we can see how well this scar is healing. She could certainly put some makeup on, and now's probably the time where we might suggest she does a little gentle massage to try and soften the stiffness. Day 19, a little bit less swollen, some cheek definition, some jawline definition, but also I think some diminution of the swelling over the central cheek area. Again, the right ear scar seems to be settling well. There is a little bit of a pinch below the earlobe, and on the left side this looks better. You can see how the jawline is well developed. Day 20, and there is still quite some signs of surgery if you look carefully. There's still the bruise under the left eye, there's still the pinch under the left earlobe. Day 21, we normally say to people it's around this time, 3 weeks, where you can start drip feeding yourself back into normal society, normal activity. Small steps, but that persistent bruise under the left eye is still there. Again, this is not all that unusual, especially in this location. I think there's less swelling today with a better definition of the face shape. Still a little pulling around the lateral eye, and again, this is very common in this location around the temple and under the chin. Day 22, I think this is a very natural photo. I think the eyes look good today. The pulling around the eyelids is less and the swelling is also less. That left eye bruise is now mostly coverable with makeup, and certainly with glasses on, then she could go out and about. Day 24, I think her swelling is noticeably subsided now. Her upper eyelids look well on show. Here she is with no makeup. This shiny skin texture is often quite common at this stage and can last for another 6 weeks. Still a bruise under the left eye. You'd think after 3 weeks it would have gone, but again, quite commonly they don't. I think this is a good photo. I think the swelling is significantly subsided. A very natural look from the front with lots of upper eyelid show and big eyes, which is exactly what we aim for from upper blepharoplasty surgery. The scar in front of the right here is almost completely healed, and the pinch below the earlobe is noticeably improved. There is a similar indent and pinch below the left earlobe, and you can see a gathering of the neck, but this is a significant improvement. Day 26, small steps again, but I think a subtle step forward. Here she is with some makeup, and I think day 27, more or less the end of 4 weeks. This is when we tell most patients they'll be able to go back to more or less normal activity and social interactions. Of course, there are still signs of surgery if you know what to look for. The bruise is still present under the left eye, and there's still some pinching and swelling around the incisions. People who know what to look for might see this. Still, I feel this is a very natural result at this stage. Still a subtle drawing of the skin lateral to the eyes, towards the temple. Here we have day 30. This is more or less for most people the beginning of the end of the first stage of recovery, where people can start doing all of their normal activities. They can go back to the gym, they can go back to anything physical that they choose to do. Again, small steps forward with an improvement in the pulling around the eyes and a better definition of the jawline. And here we are 2 months after her initial surgery. For comparison, there's the original photo in the bottom left. This is her with makeup on, going about her normal business. You can see there's still a persistence of the very subtle pinch below the right earlobe. So all I can say again is thank you to Marianne for taking the time to leave me these photos. It takes a lot of time and effort and commitment to your recovery to take a photo every day like she has. But hopefully you can all appreciate how a facelift evolves and develops in the immediate post-operative period. If you have any questions for me whatsoever about this or any other operations that we do, then by all means get in touch. Please like and subscribe to the channel Adam Goodwin Surgery, and I look forward to seeing you on the next one.